This is Dr. Mehul Mankad, and I'm here with Trip Ake. Thank you so much for joining us.
Sure, thanks for having me.
We're going to be talking about mental health treatment with special attention for children and families. But first, Trip, tell us a little bit about yourself.
I'm a psychologist with the Center for Child and Family Health here in Durham, North Carolina, and have been working with children and families for quite a long time, and just glad to come and share some things with you today. That's great.
Now, the landscape for mental health care in our state is complicated. Tell us a bit about the landscape for the treatment of mental health conditions for children.
Yeah. So in North Carolina, there are a number of services that are available to kids and families, but there's still a good number of needs and gaps. In North Carolina, there are a few different groups that come to mind who actively support services for children and families, including the North Carolina Department of Mental Health, whose role is really to identify and coordinate services in the state, the North Carolina Department of Medical Assistance, who helps coordinate and address payment for services, including Medicaid, and those are the families that we typically work with within our center, and the managed care organizations who support the regional regulations and supports for agencies to provide and get paid for services. Mental health care for children and families in North Carolina is diverse and sometimes can be overwhelming for families to navigate. It's helpful for them to have advocates for where to identify these services, starting with rosters for evidence-based treatments in North Carolina, like the North Carolina Child Treatment Program, and doing research on what treatments have the best evidence for the areas of need through online services like the California Evidence-Based Clearinghouse and several others. Just, it's one of those things that I've become more aware that parents struggle to identify mental health professionals because we don't make it necessarily easy for them through our different types of credentials or training, and so rosters, certification lists, and different online resources can make it a little easier to access.
I'm glad those things are out there. Now, for a parent who may or may not even be a veteran, how do they know that their child needs help?
Right, that's a great question. Service members and their families may want to look into additional supports if they notice changes in their child's mood or behavior or sleeping and eating habits. And for young children, we might even see changes in regression in skills. So maybe they were potty trained as a school-age child, but start having problems with bedwetting.
Right.
And so these are some of the changes that they might see. Also, kids may be more likely to complain about somatic complaints, like they might say that their head hurts more or their stomach hurts more. And some of that really has to do with kids not being able to communicate about their feelings. And for adults, it may be confusing because they'll be taking maybe to the pediatrician's office or other places, and they may check out fine, but kids may have difficulty just communicating what they're feeling.
And what kind of services are out there for kids?
There's a pretty broad span. Thinking about children and families in crisis, they may be more likely to access services through their local emergency department, or they may access services through their managed care organization. There are also a number of outpatient services directly for kids who've experienced traumatic events or who've been experiencing high levels of stress due to psychological injury or illness of a service member or other caregiver. For those children of all ages, we have a solid cluster of evidence-based treatments available in North Carolina, and those are listed through the North Carolina Child Treatment Program, which is funded through the Department of Mental Health and North Carolina Legislature. And then for families who struggle to make it in for an outpatient visit, maybe they don't have transportation, maybe they have other types of barriers that prevent them from accessing an outpatient clinic, there are home services that they might be able to access through their managed care organization.
Now, there must be different types of evidence-based treatments available for children or adolescents.
There are, and the types of services that are listed in the child treatment program include things like the trauma-focused cognitive behavioral therapy.
That's a mouthful.
It is. So that treatment is one that is often used for 3 to 18-year-olds with post-traumatic symptoms of their own due to things that they might have experienced. Parent-child interaction therapy is another treatment for young children that have pretty high-end oppositional behavior. Maybe they're getting kicked out of daycares or having trouble with aggression at home. And then there are a number of other services through the Center for Child and Family Health and through the Child Treatment Program that really target different developmental ages and different types of symptoms that are common post-trauma. And within North Carolina, those same evidence-based treatments are available. For service members and caregivers, it's important to know that the Child Treatment Program rosters clinicians, and that's something that's important for caregivers to really know. This is a preferred listing of clinicians that have demonstrated that they know how to do these treatments with high levels of skill, and they have been able to share with consultants how those cases have been going and get support on them. Again, it's kind of like a preferred listing for public and for agencies to have access to.
Now, I hope there have been efforts made to specifically engage clinicians to work with military or veterans.
There have, and I think we're becoming even more aware of the need in North Carolina given the number of service members that we have. Funding through Welcome Back Veterans Program and GlaxoSmithKline have allowed us to train community mental health workers in different parts of the state on how to be more military informed. And this really means different things to different people, different clinicians and agencies, but it could be as simple as asking a family member if they have a connection to the military or not. We also help clinicians learn about different resources that are in their local community that would help connect service members and their families to benefits. And these agencies would be ideal for veteran advocates to connect to in order to help coordinate those services. And also have online resources for civilian and military families for how to help kids deal with grief, divorce, bullying, things like that. And there's some groups that are pretty well known, like Sesame Street Workshop, that are actually putting those types of resources out. And in addition, Dr. Patty Riesick from Duke University Medical Center has been spreading her evidence-based treatment called cognitive processing therapy for adults with PTSD into community settings and extending to include family supportive components. This is a model that has been pretty familiar to VA settings who have been providing cognitive processing therapy to adults in VAs. And now we're excited that we're able to kind of spread that practice to adults in civilian communities and help support their families.
That is wonderful. Thank you so much for spending time with us today.
Yeah, thank you for having me.